Hi, I am Dr. Moumita, General Physician from Hyderabad. So, before and we have discussed about metabolic diseases, and we know the main cause for it is insulin resistant. So, to many people ask me insulin resistant. To simplify it, how it is acting, how can we prevent? So, how can you prevent the metabolic syndrome? Let us discuss about it. What happens when we eat? So, when we eat, the blood sugar increases. So blood sugar increases when the sugar is high, it stimulates the pancreas. In pancreas, there are multiple cells. So one of the cells are beta cells. From there, insulin is secreted. So insulin will go to the cells and it will ask to open the door. So it will sit on a receptors and ask to open the door so that glucose can go inside. So this is what happens usually after we eat, how the glucose from our food goes inside the cell. Now what happens when there is an insulin resistance? When there is an insulin resistance, the problem is with the door, with the receptors. So insulin is going and knocking the door, but the door gate is not opening. Loads and loads of glucose are waiting outside to enter cells, but it is not opening the door. So that is what called insulin resistance. So usually what happens when somebody is having insulin resistance, it is not the sugar level that increases very high, because some of the other way more and more insulin comes and pushes the glucose inside. So many of the people do fasting, blood sugar, post-lunch blood sugar and HbA1c and comes and say these are normal, I don't have any problem, I don't have diabetes, I don't have metabolic diseases. So that's not the thing. So first thing that we see is, if you if you try to visualize the insulin that is coming more to push the glucose inside. So first thing that will increase is insulin level once your pancreas is working properly. So this is the main pathology. Now what is happening? What are the other impact that is happening? Once the glucose level is very much more outside the body, once it is not coming inside the cells, you are feeling weak, tired and all. So what are the other signs that we can see from outside? Whenever the patient comes to us, we see there are few signs. By seeing that we can understand that they are having insulin resistant. One thing is they will have a truncal obesity. Their waist circumference will be more. Usually it is 90 centimeter for a male and 80 centimeter for a female. So we see they are centrally obese. They will have a lean and thin hand and legs, and centrally there will be obesity. So second thing to observe. One thing is all the fat is going to the main organ, or it is called visceral adiposity. So the fat is not going to inside the skin. The subcutaneous fat is not the main thing. The culprit is the visceral fat, which is coming and depositing around the organ, around the pancreas, around the liver, all this organ, around the gut. So that is the problem. Second thing, they will have sarcopenia. Their arms and legs will be thinner. If you want to know about more, there is another video where I have explained how the muscle improves the insulin sensitivity. You can see that. So second thing that we can see is that muscle bulk will become less for them because of inactivity. Third thing, that another thing that we can see is they will have skin tags. You will see the small skin bump around the neck, around the armpit we can see. Acanthosis nigricans. So there will be a black color velvety that we can see in the armpit, in the neck. So these are the things that we can see and we can understand this person probably is having insulin resistant. And if it is a female, they will have irregular cycle. Though thinking that taking that thyroid is normal, usually they will tell about that I don't have cycle regularly. So these are the things that we can overall understand that yes, they are having insulin resistant. Now how you can proceed with the blood test? Whenever we do, these are the clinical signs. Whenever we do blood test, some people may have fasting sugar high, some people may not have. Now why the fasting sugar will be high? Usually when there will be insulin, normally insulin will say to the glucose, stop gluconeogenesis, stop producing more and more glucose from the liver. Okay, but because the body is not listening to the insulin, so what will happen? Continuously from the liver, which is a store for glycogen. So whenever we eat, when the excess glucose goes, it will go to muscle and liver, it will store as a glycogen. So from there continuously there will be releasing of glucose. So when we see, when you are fasting, even though you did not eat anything, your sugar level will be high. So that is what hepatic gluconeogenesis. So that is one thing. So initially we see that some people, they will have fasting glucose high. Okay, some people may not have post meal glucose high, and for some people HDL or that means good cholesterol will be low, triglyceride will be high, uric acid will be high. These are the blood tests that we can see. When if you do a scan of your abdomen or of your tummy, we can see that your liver is having fatty liver. That means more than 5% of fat cells are accumulated in the liver. Okay, so these are the things that we can see. Okay, now you are going to go to you are already in the metabolic syndrome. So this from the metabolic syndrome slowly hypertension, diabetes, fatty liver, PMOS, all those things is going to come, and that in other way it is going to cause the most common causes of death or most common causes of problem which is happening. So any stroke, heart attack, even to or some way it is related to the cancers also. So anything that we see can impact because it is coming from the metabolic system. The starting is all the initiation or the beginning is starting from the inactivity, abnormal food habit, or more of a simple carbohydrate, more of a processed food, not working out, not going for any kind of exercises, or not even mobility. Nowadays we see people are sitting for a longer time, not having proper sleep, stress. These are the main reason. So actually we did not get all this thing by genes. We got it by our lifestyle. So try to change lifestyle. So this is the basic of our insulin resistance, which in turn is causing metabolic syndrome, which in turn is causing all kind of deadly disease that we are scared of. And it's very well reversible if you start doing intermittent fasting. So what is intermittent fasting? We are continuously eating. We are not giving time or rest to our body. We are eating, then we need. So if we give around 12 to 14 hours of gap, body will try to heal. It will stop the abnormal, whatever we are doing, the harm to the body, it will try to stop it. So first thing is stop. We have an internal clock in our body which goes as a circadian rhythm. So whenever we start eating, our body feels this a day started for them. When we stop eating, body thinks it is the end of the day. So stop eating as early as possible, maybe 6 o'clock or 7 o'clock in the evening. Second thing, go sleep early. If we are not sleeping early, we will feel hungry, we will eat more food, and as the day goes on, by the evening our digestion powers comes down and we get all sort of gastric, acidity, nausea, vomiting, all sort of GERD, all kind of diseases if we eat late and immediately after eating food if we go to sleep. Third, walk after each meal. Try to walk for 15 to 20 minutes. So whatever glucose is coming, it will directly goes into the muscle and it will improve our glucose sensitivity. So these are the things that will help for insulin resistance to get better. Sleep early, have dinner early, intermittent fasting, walk at least 15 to 20 minutes after each meal, and have more of a protein and fiber food. Reduce consumption of simple carbohydrate, processed food. So these are the basic things. For this, we don't need to do a much of thing. While doing all these things, when you are little better, then we can start doing our resistance training and other exercises to maintain our muscle. Okay, so initially start from the beginning. And later we should not think that why it is not getting reversed. Obviously once we get a stroke, reversing from there it is very difficult, but once you are already having a truncal obesity or already the signs are coming, it is very much easy to reverse from there. So start early so that you can have a better and improved brighter future. Thank you.